What is the best way, or what is the best position to sleep if you have vertigo or if you're dizzy? Well, it depends. In this video, I'm going to address those questions. Stay tuned. Do you have vertigo or dizziness? Either you've been told you have BPPV, benign paroxysmal positional vertigo, or you've been told you have another cause of dizziness. Or for some of you, you may not know one from the other. Let's briefly discuss the difference. Vertigo is often severe. It may give you the feeling that you're going to fall down or fall over. Most would describe it as you or your surroundings spinning. Very unpleasant. Whereas dizziness, it might be comparably less severe than an attack of vertigo, for example. Dizziness can have a range of sensations, including feeling lightheaded, faint, woozy, foggy, unsteady, off balance, or even weak. So let's get to it. I'm going to talk about ways you can sleep whether you have dizziness or vertigo. Trying to find a comfortable position when you're experiencing vertigo or dizziness can be frustrating. One tip I will suggest before I get into the specific positions for either vertigo or dizziness is to make sure you're moving slowly when you're getting in and out of bed, or if you're rolling over in the middle of the night. Take your time, try to keep your movements controlled so you can minimize the bout of dizziness or vertigo. I want you to grab a couple pillows. It doesn't matter the type, just make sure you have more than one so you can try these positions. The first positions I'm going to talk about are for those suffering from dizziness. The dizziness can be from any cause. The position I'm going to show you will be general. However, these are the positions I discuss with patients who are suffering from cervicogenic dizziness, the type of dizziness that stems from your neck. The key here is considering what normal alignment and posture is and trying to emulate that while in bed. And we will talk both on your back and side. So grab some pillows and let's get into position. The first position for dizziness is going to be on our back. We're very simply going to take a pillow, slide it under our knees, and we're going to lie down and support our neck. Now, most people want to support their head. I want you to think about what your neck posture is. Your neck posture has a normal, nice, smooth curve in it, so we want to try to produce that same position when on our back. This can be done very simply with a rolled pillow or a normal pillow itself. This would be more of a typical cervical pillow, the same thing. We need to get in a position that is going to support the curve in our neck and really focus on relaxing, making sure the pillow is not too thick to push our head forward, but just enough to create that nice, smooth curve and rest in a normal alignment and posture. This would be an ideal position for those suffering from cervicogenic dizziness or any other cause of dizziness. Now, when we speak about side sleeping, the same holds true. We want to make sure that we're keeping our spine in line. The way we do that is by placing a pillow between our knees. Now, the key for our head and our neck is to support the distance between our shoulder and our ear. This pillow is a pretty decent size for me as it keeps my head in line with the rest of my spine, and this would be a good position. You could also use a roll pillow. Same thing, we're going to think about our neck, supporting our neck. We want to think of the depth of the pillow. If it's too fat, my head is going to be in a curve up this way. If it's too skinny, for example, without a pillow, then my head does the opposite, both which do not support my neck in a natural way. We want to make sure our neck is being supported and it's comfortable and we're able to relax and fall asleep. Now, the biggest thing with side sleeping is we do not want to flex forward. Sometimes we do it at our pelvis, but mainly at our head. That would push our neck into forward head posture. We do not want that. Not good for any type of support of our neck, especially if you have neck dizziness or any other type of dizziness. Now, you will wake up in a different position. I understand that, but what you're going to do is just practice self-correcting. So whether you're on your back or your side, always take into consideration your spine being straight from the front and these nice, smooth, natural curves from the side. That'll be your best bet to minimize the dizziness you experience when you're sleeping, whether it be coming from your neck or another cause. Now I'm going to move on to show you how to sleep if you have vertigo. If you've been told you have vertigo that's coming from your inner ear, I'm going to show you the two best positions you can sleep if you've been diagnosed with BPPV. The first thing you're going to do is you're going to take your pillow and just put it as you normally would. The second thing you're going to do is take another pillow and we're going to place it perpendicular to the first pillow. The reason being, if you have been diagnosed with BPPV, you want to in certain cases, be elevated slightly. Now, you still want to support your lower back. The idea is keeping your head in line with your mid-back so that your head is not pushed forward. That's going to be better for your overall posture. But as well, it's going to give the crystals a chance to reposition or at least not become irritated in this position. So it's a great position to start in. One of the biggest challenges is knowing the side that brings on your bout of dizziness. Let's assume it's if you turn left in bed or you turn your head to the left, that's when you get dizzy. You want to make sure that you support yourself so it makes it more difficult to turn to that side when on your back. For some of you, how to do that is placing a pillow on that side underneath your shoulder. It just helps prevent you or reminding you not to turn to that side in the middle of the night. It can get a bit awkward with some of these pillows, but once you get the right position for you and you get comfortable with it, it becomes easier and easier. If you're lucky enough to have something like a wedge pillow, it does make it easier. It's a bigger area. Place the pillow underneath your knees and slide back. Again, you can put a pillow on this side if you have left-sided BPPV to help prevent from rotating that side. But this position on an angle shows both in my clinical experience and the research is a really good position to help minimize or prevent an episode of vertigo. Okay, so if you're a side sleeper, you're gonna like this position next. The key here is making sure the unaffected side is down. For the purposes of this video and for this position demonstration, let's assume when I turn to the right that that's going to bring on a bout of vertigo. So what we're going to do, we want the unaffected side down. So again, any pillow that's going to be supportive, it can be a regular pillow, it can be one that has the two humps or one that's cut out. You want to make sure if turning to the right is irritating, then I want to sleep on the unaffected side down, which would be my left. And this makes sense because when you're on your left side, it allows the crystals to be stable, but also it takes a lot to roll right over to the right side to cause that to irritate the crystals. So we want the unaffected side down, and for some, they might place a pillow behind them here, again, to prevent you from rolling over to that side. Anything we can do to prevent us from moving to the side that's an irritant, we want to do. So the unaffected side down seems to be the best way I've seen clinically, but also the research seems to support this position as well. Once your vertigo resolves or your dizziness improves, I suggest you follow the first two positions where you really are considering your spinal alignment to help prevent future episodes of vertigo, dizziness, or any other spinal related condition that a bad sleeping position may irritate. And remember, if you want more specific and efficient help with your problem, it's always best to seek out local professional help. I have many videos on my channel that support those with dizziness and vertigo. I suggest you stick around, explore some of my videos. I'm sure you're gonna find something that's gonna be helpful for you. If you're new to my channel and you like videos like this, first if you'd show some support by giving me a thumbs up, and maybe if you like what you see, you'll consider subscribing to my channel so you can be informed when I upload a new video. If you have a question or comment, please leave it below. I'll do my best to answer it as soon as possible. I appreciate you tuning in to watch. I can't wait to see you in my next video, and until then, stay well.